Tonight, nearly 35,000 Medicaid recipients are enrolled in a program that pays for at-home caregivers. That's according to the Department of Health and Human Services.
But experts say there is a shortage in this care, and a bill at the State House does seek to go ahead and increase the amount these caregivers are paid. Our News 19 reporter Josie Frost at the State House breaking down changes, how it could shorten the wait list for the program and also provide better care.
Through a Medicaid program, the state will pay for a qualified Medicaid recipient to have a direct caregiver at home to help them with basic tasks. But advocates say very little of that reimbursement from the state actually goes to worker compensation for these caregivers. This bill aims to change that.
Every county, all 46 counties, have someone on the waiting list and receiving services. So there's no county not affected.
Maria Reyes is with the National Domestic Workers Alliance. Their recent study found that in South Carolina, providers get $25 an hour from Medicaid to cover the cost of services. But the median salary for these workers is around $13 an hour.
You have directors from our state departments, our state agencies like Department on Aging, who's saying that they're losing care workers to places like Target and Walmart and fast food joints that pay $20 an hour.
The bill would require providers to spend at least 70% of what they're paid by Medicaid on compensation for these workers. That number would rise to 80% by 2030. Senator Darrell Jackson is the bill's sponsor.
That it challenges us to pay more using the Medicaid funding, so it doesn't cost the state anything. It basically says the Medicaid would change its formula to pay those who are actually doing the work more money on it.
According to the Alliance, South Carolina has over 33,000 people on the wait list for this service, with a shortage of workers to provide care. He says he hopes the bill would get more of these essential workers to stay in South Carolina.
When you look at some of our health care concerns, we are one of the higher states with health care concerns. We have an aging population, yet I think we need to step up our effort in providing the services for the people who are actually doing it.
According to the Department of Health and Human Services, family members that provide that at-home care for a relative on Medicaid also qualify for the reimbursement, but they still have to be employed by an enrolled health care provider and meet the requirements of the program. The bill right now is still in committee. Reporting at the State House, Josie Frost, News 19, WLTX.